Let's do a little Reddit response section, a little Reddit response segment. This is kind of like it's like an advice post that we're going to respond to. And we're going to read it, and we're going to talk about it, and we're going to respond and give a little bit of advice. It's not a Reddit AITA post. Those are always lots of fun. But this is not one of those. Not one of those Am I the Jerk videos. And I'm sorry that this is going to be probably too small for you to read. It's not possible for me to make it bigger because it's a screenshot. This person titled this Agoraphobia from Realism, and they realized later that maybe that was the wrong word, but here we go. I previously was immunocompromised and did not leave my house at all except a couple of medical reasons between 2020 and late 2021. I built up my confidence again and have been going in outdoor public spaces a decent amount, always wearing a KN95 or recently a flow mask. I always mitigate my risk. I test multiple times a week. This is from the Zero COVID community subreddit, by the way, the burps. The only time I got COVID the whole pandemic so far is when I had to be on oxygen in an ambulance on the way to a hospital in 2022. My work has an event in another city, and I want to go because it helps with career progression / I don't want to be left out on opportunities. Oh yeah, so this is something that does bother me, and we do discuss this with regards to trans people. You know, if you can't safely use the bathroom in Utah or Kansas or Florida, then professional opportunities are going to be sectioned off away from you. Like, can you go to this convention if you're not confident that you can use a public restroom without being arrested or assaulted or some combination thereof? You know, these people have to make choices about where it's safe to go. And the same is increasingly true for disabled folks. You know, are you going to miss out on this work conference that's going to further your career because no one else around you is going to take precautions? And like that is just increasingly going to be a problem because more and more people are going to become immune compromised because COVID damages your immune system, and we're heading a direction where it's basically going to cause acquired immune deficiency syndrome or AIDS, like SARS caused AIDS, whereas we are mostly familiar with HIV-induced AIDS. So this person continues saying, I didn't realize how bad it was, just how stupid and selfish people can be in high-risk situations, and it makes me question what I'm even doing in normal day-to-day life. I got to the airport, and the security line was pretty full. I was wearing my flow mask with a pro filter, and I tightened it more than I even normally wear it. I noticed nobody was wearing K/N95 masks, and there was a single person wearing a surgical mask. Literally moments later, there was a few people ahead of me in the line. They saw a different couple they knew, and they started talking, and the other people asked, oh, how are you? And they both said, not good, we have COVID, with no masks. So these people are in an airport, planning on going on an airplane with like limited airflow on the airplane. They're just planning on expelling their COVID into the air and getting other people sick with absolutely no regard for community responsibility. We clearly have like lost what the concept of public health is at this point in this country. Everybody within earshot looked disgusted and scared, and about 40% of them put on masks. This made me quite angry, and I said, that's disgusting, pretty aggressively, and if you tested positive, you should be at minimum wearing a KN95. And the wife said, oh, we didn't test. Like, okay, how did you know that you have COVID, I guess is a question. Maybe they were just exposed to it and they knew that. I've been carrying a bunch of KN95s for myself, and I gave 2 to the woman and she put it on, but then the husband said, it's my right to not wear one. And I again quite aggressively said, have a shred of some community preservation. I kept my distance. I trust my mask will do its job, especially that it's because it's a really high-end one, but I absolutely hate that people think it's okay to be like this. I used the word agoraphobia in the title, and I can't change it now. I was advised to edit the post to add that this is not necessarily agoraphobia because that's typically out of paranoia, but this is not paranoia. They're not tracking cases. They're not telling people to get boosters. They're forcing people to go back to work. It is disgusting. This is more event post, but if anybody has support to offer with this, let me know. I already have pre-existing conditions that long COVID is a very real possibility, and I am terrified of existing. How do I mitigate this extreme aversion to public spaces when it's a genuine threat? I am worried about this myself a little bit, like in that sense of like, how do you treat trauma if you're still actively trying to navigate a deadly situation? You know, like a pandemic is like the things that can cause PTSD, according to, the DSM, are life-threatening events happening to you or to other people. If you're assaulted, that is a potentially life-threatening situation, or it's a situation that makes you feel like your life and safety could be in danger. A natural disaster, if you live through a tornado, or if someone you love lives through a tornado, that can change your basically epigenetics to where you have this like PTSD response, this aversion. And it's really tough with COVID because it's not unjustified. Like the feeling that you have, the aversion that you're experiencing, the anxiety that you're experiencing, it's all justified because there are people out there spreading a deadly and disabling virus and not taking appropriate precautions and not using prophylactics and just being like, well, it's my right to not wear a mask. Like, oh, okay, so you think that it's your right to get other people sick? You think it's your right to potentially kill or disable someone? If you cough on someone and you're sick, like if you do it on purpose, that's assault with a deadly weapon in a lot of places because you're knowingly infecting someone. It's the same way that like, if you know that you have HIV and you don't disclose and you have sex with someone without adequate protection, like that's assault. That's a crime. Personal responsibility as a concept has been so thoroughly screwed. Like it's absolutely insane to me that anyone would knowingly travel like this while sick with it. You know, like it's crazy that people just don't seem to have a concept of forward transmission, community care. Hey, you should like, comment, and subscribe. And you can hit up the Patreon or maybe buy one of these hoodies that I'm wearing because it's good merch. Do it. Do it for the cat. Do it. Yeah, I wouldn't get on a plane without a mask if I had a cold. And see, this is the thing. I also saw this post recently that was a lady talking about how she had been to her, she was getting some medication infused through her port. She does not have cancer, but it was a cancer ward. Like other people there had cancer. And the nurses were basically just saying like, oh, well, we never used to mask before in an oncology unit. And it's like, maybe you should have been, because even a cold can potentially be deadly to a person who has no immune system because they are going through chemo. You would think that like, but I think there's this intense desire for things to be normal, to pretend like there isn't this disease going around, because then you have to actually face up to your place in community transmission. You know, I don't even know if you are a nurse working in an oncology unit, a cancer unit, and you come in with a cold, and some of this is from capitalism too. You know, for example, you might not have any more sick days. And your boss might be threatening to fire you if you take any more sick days. But maybe they're also not providing you with PPE. So maybe, they're expecting you to pay for your own masks if you're going to wear a mask. And there's probably a social environment discouraging you from the mask. But like, if you take any more time off, you're going to lose money, or you might lose your job entirely and therefore lose money. So I'm not saying it's easy per se, but I'm saying that it is the right thing and that we should collectively push back on acting like this is like normal, like that spreading disease in general is normal. Like I know somebody who got sick with COVID because their friend had it, and like they were like, oh, I feel bad that I am not able to see anyone even though this is a really mild infection. And I'm like, well, maybe we should have always been treating our infections this way. Maybe when we get the cold, we should stop seeing people or wear a mask if we're going to go see people. This is a post here. So they're quote tweeting someone who says, not one healthcare worker on this team is wearing a mask to protect this severely immunocompromised toddler who has stage 4 cancer. Before the pandemic, we at least wore surgical masks in these units. We're normalizing killing children in new ways each day. Yeah, okay, so this is a child with stage 4 metastatic neuroblastoma in an entire hallway of people with no masks. And then this is a screenshot or a photo here saying before the pandemic, it was not just commonplace to wear surgical masks in these units. It was commonplace to even wear duckbill respirators. I did a quote hero visit at a children's hospital 10 years ago where they had all visitors near immunocompromised patients wear N95s. So, some people are saying, oh, we didn't used to wear masks. And these other people are going, oh, well, we did used to wear masks, but we're not going to bother anymore. Like, this is what I mean when I want to blame this on the brain damage that COVID causes, that a virus might change the way you think about spreading disease. Not like intentionally, but like if it is causing brain damage that causes you to think less about spreading, then it's going to spread more. And there's going to be this, like, I also was reading this thing about how some diseases actually cause you to want to go out and do things, even though you feel like crap, because it will create this forward spread situation. Like, it is evolutionarily advantageous for them to change your neurochemistry to make you want to go do things, to make you feel like you should be active while you're very ill. I would have been litigious at that point and accused the couple and airline of public endangerment. This is like a thing where the law is not going to catch up with the reality of the situation. Like, I have no idea if the law is ever going to catch up on this, because I think if you have COVID and you knowingly go on an airplane with no mask on, like, that should be a crime. And one of my other friends when in response to this whole situation with the nurses, like this, there's a lovely lady who in this video who's like crying about I'm not going to play the video right now, but like 2 minutes of this lady just crying because she's like, these nurses genuinely don't seem to care about getting their patients sick. Like, you should lose your ability to practice medicine, if not go to jail. Like, so long as we have jail, I think that this kind of thing should be punishable by law. Like, we need some kind of real, tangible community punishment response. Yeah, actual Spider-Man would wear a mask, truly. Byron says, it's bizarre to me that this is basically a cultural thing. I remember there was a student wearing a mask months before the pandemic started because where he was from, that's what you did. Yeah, I do think that it is a pretty uniquely American problem as well, that we have this hyper-individualistic view on things in this country, in this culture, where it's like, whatever, I have the right to do whatever I want to do. And it doesn't matter if that damages other people's right to be in public. There is this feeling like, oh, well, if you're going to get sick, then you stay home. I don't need to change anything about how I'm living my life. Whereas, I know it's very common in Asian countries for them to wear masks if they have the sniffles, because there's a sense of community responsibility. There's a sense of responsibility and guilt, perhaps, if you are sick and you get someone else sick. It is your fault. If you are sick with COVID and you get someone else sick with COVID and they die, you have killed someone with extra steps. Like, it's manslaughter. If you did it intentionally, I think that we would increase the charge. But if you did it, if you were like negligent homicide, maybe, or manslaughter, maybe, but it's a crime against humanity, effectively. And the fact that there is no legal mechanism for it is a travesty, in my opinion. And I don't know why airlines themselves, private entities can make moves on this. You can say, hey, this is an airplane. We can only do so much with getting fresh air in here when we're in the upper. So because it's like, for the same reason that you can't smoke a goddamn cigarette or you can't vape, you're not allowed to do those things on an airplane. You should also not be allowed to like spew your disgusting germs everywhere. I used to work in SK and Japan, and people, South Korea and Japan, and people just wear masks when they get sick as a matter of common sense and civic responsibility. Yeah, I don't trust anybody. This kind of situation reminds me of what some people will say, like, you can't just eat at anybody's house. You don't know what they did to cook the food. Like, I saw a picture where like somebody's dog was sitting on the kitchen table and somebody was like, yeah, you can't just eat at anybody's house. You never know. Somebody cooked something in the back of the toilet or something. Like, there's all kinds of nonsense. And it just makes me feel like this is quite similar. Like, you can't just be around anybody. They might be positive with COVID and know that and still breathing right in your face. I do think when I'm wearing a mask in public, I basically don't see other people with masks the majority of the time. And I do think people cough when they walk by me on purpose. That's the extent of anything people have done. Like nobody has gone like coughing on me, but I do think that people cough near me on purpose. And I think that part of it is that I am shaming them, like that they know on some level that COVID is still around, and that like, isn't it weird that my kids keep getting sick and I have to pull them out of school? And they, you know, they feel shamed because I am doing something that they know that they have a moral responsibility to do themselves. But it at the end of the day, yeah, it's a difference in our approaches to facts and science. I'm not listening to the CDC. The CDC is a political organization. I'm not basing my behavior off of their recommendations, because obviously they changed their recommendations based on Delta Airlines requesting them to reduce the amount of time that they were recommending quarantining. And it's a difference in morals and like community responsibility and ethics. And those are the changes, like those are the differences that I don't know how to bridge. I don't know how to bridge a difference with somebody who just thinks, oh, I have the right to spread disease. Like, I mean, I guess technically on paper you have the right, but like ethically and morally, are you in the right? Because that's a different question. COVID has shown that we are already cooked. On paper, we have the resources and the science for a pandemic to be prevented, yet we did no better than a century ago. Yeah, and unlike many pandemics in the past, this one continues to mutate, continues to change, and like disables a large swath of people who are catching the disease. And the increase, like there's an increased chance of you having long-term complications every time you catch it. Like there is an epidemic of children with long COVID who are being brushed off and ignored. And they're being told, oh, well, you just need to be more active. And they're saying this to kids that used to be on like every sport possible and for whom they have post-exertional, which makes their symptoms significantly worse if they push past their limits. So yeah, it's like you can't live in a society with these people who are deliberately spreading the disease or who are negligently spreading the disease. You just can't live in the society with them. You have to like wear your own mask, hope that one-way masking is going to be good enough, use other preventative methods. Like my friend was just telling me, if you use a saline nasal spray with xylitol, that is showing, like a lot of people are showing that helps if they're engaging in high-risk activities. It prevents them from getting sick. If you use mouthwash with CPC, that can reduce the infectivity of SARS-CoV-2. And I take Streptococcus salivarius K12 probiotic because it's a healthy bacteria that, first of all, is correlated with healthy dental health, but also has been shown to reduce viral transmission in young children who can't wear masks and don't take precautions. So there are things you can do besides just mask as well that will keep you safer. And I think that it's important to keep the knowledge that like you don't have to accept some kind of normality of COVID. You don't have to just accept that you're going to get sick over and over and over again. There are things you can do. You can live your life normally. You can even go on an airplane. I personally wouldn't, but you can go on an airplane and take these precautions and like just assume that everyone in your immediate vicinity has COVID, because apparently people are just going on airplanes and they think it's their right to get you sick. I agree, Hales, that the fact that being at an airport exposes you to such a large pool of people in a confined space from literally all over the world, wearing a mask should be treated like washing your hands. Simple. Yeah. Remember like going to cons and getting con crud was just considered normal? Like, why are we just letting it be normal that we get sick when we go to a large gathering of people indoors? Why are we treating this like it's just fine? People have been known to mask up and wash hands since the Dark Ages. These people are literally dumber than medieval peasants. So upsetting to me. Agree, Noah Darkly. Like it's a severe regression, I feel. It's a serious regression. And I can only hope that these people get permanently disabled in such a way that they can't leave their homes before they kill too many people with their forward spread. It is true that the primary purpose of a mask is to protect other people from your germs, but N95s, P100s, flow masks, they are fairly effective at keeping you from getting sick. I wear an N95. I go to the gym 4 days a week. And there are people actively sniffling and coughing without covering their mouths in the gym, and I don't get sick because I'm taking all these various precautions. So yeah, just be informed, y'all, and trust no one, because people cannot be trusted. End of. Take all precautions that you can, because people cannot be trusted. Happy Pride to my patrons, especially Tiago Nascimento, Mersh Rolvog, Jack, Amanda B, Wellington Marcus, Michelle Frateroli, Michelle Winter, Danielle McDonald, Jamie Jam, DZXN, Nova, Sojo, Athiet, Spooky Heather Sylvia, Desi Quiche, Pasnell Infinity, Celeste, Kevin Young, Elizabeth Bartell, Liam Hodgson, Ella V. Nobody, Mr. Atheist, and Suzanne Maynard.